In this second streptococcus video, we're going to talk about group A strep, also known as Streptococcus pyogenes. Keep those two terms synonymous in your mind. You'll see that abbreviation GAS often, and remember which organism it's referring to. Of course, there's a wide range of group A strep. There are some that are essentially harmless, that are living in the nasopharynx now, or the oropharynx rather now, and there are others that are really professional pathogens, and anytime you encounter them, they're likely to cause disease. So what we're going to do is we're going to look at some of the virulence factors that many of the group A strep species have. And I'll try to give you some sense of which ones are pretty much universal and which ones might be more optional equipment. Now, group A strep often carries a protein on its surface called M protein, and what M protein does is messes with the ability of complement, one of the two important opsonins, to bind to the surface of the cell. When complement can't bind to the surface of the cell, that inhibits phagocytosis. So M protein acts kind of like protein A on the surface of Staph aureus, though it does it in a very different way. The net effect is essentially the same. It slows down the ability of our phagocytes to capture these cells and digest them. Now, group A strep typically has a capsule, and its capsule is made from a carbohydrate called hyaluronic acid. So stop and think for a minute. Where have you heard of hyaluronic acid before? Okay, hyaluronic acid is an important molecule in other ways. So I want you to think about where you've heard of that before and why might it be a good cloaking device, if you will, for a capsule. So why might a pathogen like group A strep want to clothe itself specifically in hyaluronic acid? I'm not going to directly give you that answer, but I want you to think that one through. Now, in addition to some antiphagocytic determinants, there are some virulence enzymes. Streptokinase is quite common among group A strep species. As we know, kinases break down clots and allows the spread of the pathogen. Because of this, many group A strep infections are in fact systemic infections. They can spread very easily because when our immune system tries to wall them in through clotting, they break right out with the kinase and they spread to other locations. Some group A strep have been found to carry a hyaluronidase. Fortunately, that's very uncommon, but it breaks down hyaluronic acid, which allows for spread of the pathogen as well, and can allow for some deeper invasion. So keep that in mind, that there are some very scary, highly invasive group A strep species in circulation. Fortunately, they're not very common, and we're not going to come across them all that often, and we hope that it's going to stay that way. Now, in addition to the virulence enzymes and the antiphagocytic factors, there are toxins, secreted proteins that are toxic to you, the host, that weaken you, weaken your immune system, and just make you an all-around better petri dish for them to feed on. These two are they're common enough that we come across them, but they are not by any means universal. So the first are called the pyrogenic toxins. Pyrogenic as in heat producing, they stimulate fever always. These are also sometimes referred to as erythrogenic, as in generating a redness, because they also often cause widespread rash. These pyrogenic toxins are responsible for streptococcal shock, toxic shock. It can be a pretty scary infection. And then the streptolysins are a group of hemolysins. They are cytolytic specifically against blood cells, red blood cells, white blood cells, and platelets, making group A strep bacteremias particularly dangerous. Now let's look at a couple diseases caused by group A strep. On the left, you can see acute pharyngitis, what we commonly refer to as strep throat. As a follow-up or latent in a stage reactivation after someone has had strep throat, we can see scarlet fever. Typically it's in children, though not always. So scarlet fever always follows on the heels of a bout of strep throat. Weeks, sometimes months, rarely it goes further than that into years, but I suppose it could. And you notice there's this blotchy rash on the back of this child's back, and then the inset shows this sort of classic strawberry tongue, they call it. Now, strawberry tongue alone, without the rash and without any history of strep throat, could be a variety of things, including thrush, which is a yeast infection. But if you see that strawberry tongue, and you also see the scarlet fever looking rash on the back, and there's a history of of some sort of acute pharyngitis, whether or not it was diagnosed as strep throat, you should suspect that, that what you're looking at is scarlet fever. Then on the bottom right, we've got an example of cellulitis. Cellulitis is an infection either by group A strep or sometimes Staph aureus, just under the top dermal layer, getting into the fats and some of the living dermal tissue in there. And it tends to spread like a rash. We most often see it on the extremities, especially the shins and the calves for some reason. It's warm, it's red, and it does need to be treated because it can spread. It can become invasive if it's not taken care of. And then in the upper right, I'm not going to name that infection. You've seen that picture before. Go back to your old slides and figure out what that is. That is a skin infection that can be caused either by group A strep or by Staph aureus, or if you're really lucky, you can have both of them at the same time. So make sure you recognize that particular infection. Now, a very rare but a highly complicated, high mortality infection is what we call necrotizing fasciitis. Necrotizing fasciitis can be caused by a variety of organisms, but group A strep seems to be the most common. It would be an invasive form of group A strep. There would be enzymes like hyaluronidase, possibly even collagenases involved, and other virulence factors that are not allowing our immune system to get in there and destroy that organism before it destroys a whole lot of tissue. So when you think necrotizing fasciitis, keep in the back of your mind, group A strep is likely one of the more common causes, but there are in fact other possibilities that can cause necrotizing fasciitis. Fortunately, this is one we don't see very often, and that high degree of invasiveness is not common.